It's a pleasure to be here today to talk to you about the work that we've been doing to develop two novel asset classes to target the vaginal microbiome to improve women's health outcomes. So next slide. So to provide some background around the vaginal microbiome. So vaginal dysbiosis is a disruption of the natural vaginal microbiome in which Lactobacillus crispatus, which is the most optimal health-associated microbiome, is replaced by a community of diverse anaerobes. And when that happens, these diverse anaerobes break down the natural barriers that exist within the mucosal tissues of the female genital tract and instill a lot of inflammation within the genital tract, which then actually impacts all of these multiple diverse health outcomes. That includes bacterial vaginosis, which is a form of vaginal dysbiosis, which is oftentimes accompanied by symptoms such as odor, discharge, pain, and can significantly impact the daily lifestyle and sexual health of women everywhere. Additionally, vaginal dysbiosis has been shown to dramatically increase the risk for spontaneous preterm birth, probably by increasing local inflammation within the tissues of the genital tract and reproductive tract and impacting pregnancy outcomes. But it also has been shown to impact a number of other important reproductive outcomes, including sexually transmitted infections, infertility, cervical dysplasia, high-risk HPV, and HIV acquisition. And the challenge here is that current standard care therapies are poorly efficacious with over 50% recurrence rates after just a few months and have not changed in over 40 years. So the standard care recommendations have not benefited from any new innovations in this area with new classes of therapeutic interventions for quite some time. And dysbiosis affects an enormously large group of women globally. So almost 30% of women will be affected by bacterial vaginosis. But beyond that, there are millions of additional women who will be impacted by the increased risk that vaginal dysbiosis provides for things like cervical dysplasia and HPV clearance, again, spontaneous preterm birth, and decreased fertility rates with IVF, where up to 400,000 women who are undergoing IVF treatment are affected by vaginal dysbiosis. And our conservative estimates is that this represents an over $13 billion total addressable market just through these indications within the US and Europe. So for preterm birth, looking at sort of the interventional options that are out there, really one of the mainstays is a surgical cervical cerclage, which is a surgical procedure that helps to reinforce the cervix. But that, of course, comes with all the incumbent risks associated with that surgery. Things like antibiotics have shown not to be effective, or experimental therapies that are current development primarily target modulation of the immune system, which we expect will also have additional risks. However, there has been an early phase 1 trial looking at a Lactobacillus crispatus live biotherapeutic that actually has shown a greater 50% reduction in preterm birth. And we think this helps emphasize and demonstrate proof of concept that this approach could actually really have a strong impact on preterm birth risk. For suboptimal outcomes with IVF, there again are not many therapeutic options to support women with vaginal dysbiosis, but we do know that vaginal dysbiosis is associated with 30% reduction in IVF success. So with a single intervention that targets the vaginal microbiome, we believe that there's an opportunity to affect multiple really critical reproductive outcomes that affect women globally. So we've been focusing on developing two asset classes. One is a novel live biotherapeutic, which we call LC-106 and LC-115, which has already completed phase 1 trials. And then another prebiotic, which is based upon the effects of selective long-chain fatty acids that are naturally occurring compounds within the human body, but that can selectively promote the growth of health-optimal Lactobacillus crispatus while inhibiting the growth of BV-associated bacteria. For the LBP, we have two consortia that are comprised of multiple strains of Lactobacillus crispatus that are globally resourced. So these were strains that were selected from both populations here in the US and sub-Saharan Africa that were then genomically selected to create two unique consortia, one called LC-106, which is a 6-strain consortia, and another LC-115, which is a 15-strain consortia. These have both been through early phase 1 trials, and we're happy to see that in preliminary proof of concept data, we see an almost threefold improved performance of LC-106 relative to standard of care treatment with antibiotics. This is now actually being further optimized and is planned for phase 2 studies shortly within the next year. For long-chain fatty acids, what we've shown in preclinical work in a paper that came out last year in Cell, that specific long-chain fatty acids, such as oleic acid or 10R-HSA, can take mock communities of BV-associated bacteria and selectively shift them to Lactobacillus crispatus dominans, either alone or in combination with antibiotics like metronidazole. So we've, based upon these encouraging preliminary data, we've actually developed a product containing long-chain fatty acid, oleic acid, in a product that we call LCFA01. This prototype is now actually being developed, is undergoing preclinical safety testing, and will be starting an early phase 1 trial in the first quarter of next year. We think that these two asset classes have significant advantages of what's actually being developed out there in the field currently. Either single-strain Lactobacillus LBPs, which are usually from a single geography, oftentimes selected just based upon growth properties, or experimental methods such as vaginal microbiome transplant, which are really not scalable solutions and lack real geodiversity or defined consortia that would be necessary for further development for clinical applications. And so overall, we'd like to say that vaginal dysbiosis clearly represents a significant opportunity and unmet need, where a single intervention could potentially impact a number of very important reproductive outcomes in an area where current standard of care really fails to serve patients well enough. We've developed LC-106 and LC-115, two novel, rationally designed LBPs that have shown early efficacy in phase 1 trials for recurrent bacterial vaginosis. We are also developing LCFA compounds which demonstrate promising preclinical data, and we'll be entering phase 1 trials in the first quarter of next year. And we'd like to note that all of this work has been actually supported by a significant amount of non-dilutive capital, which will actually carry the LCFA compounds all the way through phase 1, phase 2A trials, and will continue to support the development of the LBPs. So we're looking for alignment, for introductions with aligned partners who are interested in having an impact on women's health with potential global implications. So thank you very much.